Take Back Your Health Now, episode 94. Information contained in this podcast is not medical advice. It is for educational and informational purposes only. Please consult with your doctor before making any health choices.
You're listening to the Take Back Your Health Now podcast, the show that interviews the top doctors, athletes, trainers, and entrepreneurs to help you find the holy grail of health. Now here's your host, Dr. Dan Margolin.
Hi, this is Dr. Dan Margolin with another segment of Take Back Your Health Now, where we pull out all the stops in search of health's holy grail. We're very excited to have Dr. Todd Nelson. He is a well-known naturopath. He holds many advanced certificates in clinical nutrition, functional medicine, first-line therapy, and personality assessment. He has been serving the Denver, Boulder area in clinical practice for over 32 years, integrating comprehensive, holistic modalities, including functional medicine testing, clinical nutrition, medical-grade dietary supplements, detoxification, fitness, herbal medicine, lifestyle counseling, stress mastery, and life coaching. He's a nationally known speaker, teacher, and author. He was the host, owner, producer of the popular radio show Get Healthy, Colorado's #1 talk show on holistic medicine. He's also co-author of 3 books, one called On Arthritis Survival, one on Asthma Survival, and one on Headache Survival. So we are very honored to have you, Dr. Nelson. How are you, sir?
Good morning, Dr. Dan. I'm very good. Thank you.
Wow, that's some bio, man. And actually, it's much longer than that. I didn't read all of it. Like, how do you have the time to even brush your teeth in the day?
Well, I have to practice what I preach, so I have to take care of myself first. So I do a lot of good self-care practices. Also, the fact that now it's approaching 35 years in practice. Over 3 decades, you learn a lot and you're able to put out a lot. At least I've been able to do that. So I feel very blessed.
Well, tell us about how you got started in your field, and what we'll jump into specifics on arthritis, on headaches, on asthma and stuff, but also just I'm always curious, like somebody that's 35 years in practice, if you could talk to your original self, right, and sort of summarize, like if you had 5 minutes to sit down with yourself 35 years ago and summarize what you learned, I'd be interested to see what you would say to yourself.
Yeah, I think I would be pretty blown away. I would say to myself, gosh, one, you're really lucky that you've learned what you've learned when you have, because my entry point to natural healthcare was my own health, with many docs in this field. And I had chronic digestive problems as a teen. I also have a rare connective tissue disorder called Ehlers-Danlos syndrome.
Oh, wow. Sure.
Which has affected me my whole life. As far as you're familiar with that?
I am. Yes. How did it present?
Well, it presented early on mostly as muscular trigger points and aches and pains and excessive fatigability and, of course, hypermobility in joints. So I could more easily injure joints. So in my teen years, I was a ski racer and I was in college and I was injuring easily. I couldn't understand it. I was having chronic digestive problems. And what happened was I was going to all these doctors, hitting walls. I wasn't getting the care and the help that I really needed. I wasn't really being listened to. And interestingly enough, Dan, nobody ever said, "What do you eat?"
Unbelievable, right? Like that wouldn't be part of the whole syndrome.
Not even one doctor, until a chiropractor who was making house calls seeing my mother sat me down one day at the age of 17 and said, "What do you eat, Todd? And this could be related to your digestion." So he started coaching me. I started changing my diet, modifying my exercise, learning how to relax. And lo and behold, my digestive problems went away. So that really caught my attention. It put me on a mission, basically, where I said, why doesn't everybody know this? Why doesn't use this as a first line of intervention?
Dr. Nelson, let me ask you a question. So when he said that to you, what were you eating and what changed? What did you, how did you change your eating?
I was the typical suburban kid, and I thought it was really quite a value to be able to drive over to McDonald's every day in high school and grab lunch for $1.50.
Sure, sure, right.
Starting my meals, Captain Crunch or something. And then midday, I'd have something like Taco Bell or McDonald's or some sort of fast food. And
So are you telling me there's something wrong with that?
well, I think it would have died an early death had I kept that routine up.
Well, I think it's cheap. You buy it, it's cheap, but you pay for it later, basically, right? I mean, it's like putting it on a giant credit card. Yeah, yeah. So you change that diet around. What do you change it to, and how quickly do you notice a difference?
I started eating more vegetables, which I wasn't doing. I started going to the health food store and shopping. I started, even at that age, started doing some of my own food prep. I starting my day differently rather than with sugary cereals. I started with things like eggs and vegetables, which is a pretty weird thing for a teenager to do. Within 3 months, my chronic digestive problems that I had for at least 5 years disappeared. And I've never had them since. I was chronically constipated, in pain, having cramping, bloating, etc. And all I did was change those habits. And that caught my attention. It's something I never forgot. And it pretty much set me on my mission for the next 30 years.
Wow, that's powerful, powerful. And nobody had even thought to ask you that prior to that chiropractor speaking with you.
I had counted 7 physicians. They were all trying to figure out, they're saying, oh, you have irritable bowel syndrome and, take these laxatives or take these antispasmodics to relieve the cramping and the pain. It was all symptomatic treatment. Nobody was saying, what is the cause of this problem?
Yeah, I got to tell you, having done so many interviews now for this show and stuff, what strikes me is that when we talk to experts like yourself, I mean, really the top guys and gals, they're talking about not necessarily treating the symptoms, but looking for the causes. And that is a different viewpoint. I think we've been so used to treating symptoms for so long that we've forgotten that those symptoms are related to something that's caused them. And I think it's more important to go after the cause. Would you agree?
Absolutely. And, a lot of times our patients need relief in a short period of time. If they're in pain or they're really suffering, they might need something for symptomatic relief, meaning I would not discount that. Nonetheless, arthritis. Arthritis is one of the biggest causes of disability in America. And over 22% of the population has some sort of disability, some sort of arthritis that is starting to disable them. And it's interesting because, what's the typical approach to arthritis from a conventional medicine standpoint is, well, let's just treat the pain.
Right. Naproxen, Motrin, Feldene, nonsteroidals, those kind of things.
Exactly. The nonsteroidal anti-inflammatory drugs. And in the short run, you're going to feel better. Probably. You're probably going to have less pain, more joint mobility, etc. And it's like, wow, that's miraculous. On the other hand, about 18,000 or 19,000 people die annually from taking medications because of gastric bleeding.
Yep.
And I think other guests have talked about.
Yeah, I was actually surprised. We had another guest just talking about the actual numbers, and it was pretty shocking. I wasn't aware of how many people actually die from these kind of drugs.
Yes, it's mostly from gastric bleeding because it thins the gut lining. So most of the time when you go to the doctor and you're starting to have aches and pains in your joints, for example, the base of your thumb is a really common area where osteoarthritis starts coming up. And it might get stiff, sore, it might be worse in the morning, be on your computer or hold your pen and write, etc. Or let's say hold a cup of water. Most people don't do anything about that for quite a while. It's like, oh yeah, it's kind of bothering me, but I'm just going on with life, doing my thing, not really doing anything until it starts to get severe. And at that point, and you may see this, of course, as a podiatrist and seeing this with people's feet and ankles and knees and so forth. But sometimes they don't to do anything about it. And the first intervention is using the nonsteroidal anti-inflammatory drugs where they get relief but they go right back to the behaviors and the choices on a daily basis in their lifestyle that could be actually fanning the flames or putting the gasoline on the fire, so to speak, of the inflammation in their joints.
Now, Doc, do you think that's just because they don't understand, like they don't have the knowledge, nobody's ever actually showed them, or like why do you think that is?
It's a very good question. I think most people are just ignorant of those choices could be compounding their joint pain or even causing it. And most of the time, docs, unless they're trained or interested in things like functional medicine or natural medicine or lifestyle medicine, they're not really saying, okay, let's take a look at what's going on in your lifestyle that could be either causing or aggravating this problem. And sort of working backwards and saying, okay, what are you eating each day? What kind of food choices are you making? That's, in my opinion, that's number one, because the primary source of the inflammatory chemicals that are going to be aggravating the joints.
Dr. Nelson, let's do this. I just want to step back for 1 second because I definitely want to jump into this food concept. But when we're talking about arthritis, I know there's different types of arthritis. So let's, just so we can define it a little bit for myself and for the audience. So there's osteoarthritis, which is almost like what would be considered a wear and tear arthritis, right? Where the cartilage gets broken down. Is that pretty correct?
Yes, that's when you're losing cartilage between the joints.
Okay. Then there's rheumatoid arthritis, which is almost like an autoimmune where your body is sort of attacking the synovium around the joints. Is that pretty true?
That's exactly right. Yeah.
Okay.
Your immune system starts becoming out of control and attacking normal tissue.
Okay. So would those be the two overriding types of arthritis? Is there any other types that we would be talking about?
Well, there's many types. But those are the two primary types of arthritis that I would say the majority of patients are. There's more. There's other types like psoriatic arthritis and some other forms of arthritis that are a little more rare. Many of them have an autoimmune component similar to rheumatoid arthritis.
Right. Okay.
And those can be deciphered with a rheumatologist doing good blood workups and physical exams.
Understood. So now when we're talking about the food choices and all of these different things, we're addressing all of these types, right? It's not just that we're just dealing with the autoimmune, or are we? Or are we more going towards the osteoarthritis or the rheumatoid or both of them when you're talking about these choices?
Well, in our book, Arthritis Survival, we were really focusing on osteoarthritis. There is some similarities, there's some crossovers between osteoarthritis and rheumatoid arthritis. For example, in both cases, you want to protect and hold on to your cartilage as long as you possibly can. And the loss of cartilage in each type of arthritis is from different causes. In the rheumatoid arthritis field, it's more from your own immune system attacking your joints, and you're really highly inflamed, and then you can start losing cartilage and actually go into deformity of the joint, possibly lose the joint altogether. Now, with osteoarthritis, it's more cartilage over time. And this is usually because of inflammation and also because of other metabolic issues that are playing into losing the cartilage and not repairing like you should be. Some of that's based on aging. Some of it's based on overuse. So there's many factors that are going to play into that.
See, this is so interesting to me because much of what we treat as podiatrists, I mean, clearly we see patients with rheumatoid and psoriatic, but it's such a small segment. The majority is osteoarthritis. Right. And so to understand better how nutrition and other things, like one of the things we do as podiatrists is to alleviate the pressure on those joints. We'll make orthotics or we'll do things to try to realign the joints so that you're not getting that wear and tear or that grinding away the cartilage. But I'm fascinated to learn for the patients other either alternative things or things that we could add on to actually help them with that. So, yeah, please, I didn't mean to cut you off, but please proceed with that.
No, that's great, Dan. I know that probably a lot of your patients stage arthritis where they're possibly even losing joint function.
Yeah, they're not coming until they're in pain. I mean, it's like that's the basic thing is there, and usually the pain has been there for months, and usually by the time they get there, it's really affected their lifestyle. So we're seeing them a little bit towards the end of that range where they're able to tolerate it. And it is one of the things that I think people are accustomed to in medicine right now, where let's wait till it gets so bad. Where it's a shame because when we can still pick these things up before they're actually symptomatic, when we start to see some loss in function, right, where there's some slight decrease in function, where we can address it much easier. But that's not what we see typically. We usually see the person calling us in a severe pain and with the foot a lot of times it's pain with the first step in the morning or where they just can't get out of bed anymore. So yes, we see it more at the end stage.
Exactly, yeah. And, and wonderfully enough, I mean, medicine and podiatry and so forth offer from a standpoint of pain relief, joint replacement if needed. Now there's stem cell therapies that can be injected if, and in some people that's useful.
I got to tell you, we started doing that about 2 years ago. And yeah, we found it to be very, very effective.
It's very effective. It's exploding around here in Colorado. But again, that's sort of reserved for the late stage of things when you have to have heroic medicine. You've got to get in there and try and save tissue. But dialing back from that, let's say, I mentioned early on, let's say if you get some soreness and stiffness in the base of your thumb or your knees or your hips or your low back, these are common places where osteoarthritis starts setting up. And I think the common thing is, well, just go back to life as usual. But what I would really emphasize for listeners is at the very first onset of the symptoms is the time you have the greatest potential to derail that disease process and start paying attention and making about what are you eating, how are you exercising, what kind of supplements are you taking. You need a detoxification program. And then reach out and get coaching from somebody who's qualified to really take you through that, because that's the time to really intervene. Because, of course, as you know, there's a point in the joints of no return.
Right.
It's like, okay, the joint's gone. Now it's heroic medicine. You got to get a new joint, or you've got to get more of an interventional stem cell therapy.
Dr. Nelson, let me ask you. So we're going to these areas of vitamins, minerals, detoxification. So taking detoxification up for a second, what is that, and what are we detoxifying from?
That is, great question. Back in the early days of naturopathic medicine, even back in Europe in the early 1900s, the first intervention with arthritis, for example, as well as many chronic diseases, was to fast the patient. And that sounds pretty radical these days.
Right.
But what happens is we all get a certain toxic load on our body just from the digestive process itself. And then if we're eating a modern diet that's loaded with sugar, loaded with saturated and processed fats, loaded with colorings, loaded with pesticides and herbicides, possibly things like heavy metals, and we start stacking up this toxic load exposed to lots of toxins in the environment, even cleaning fluids in your house, or paint outgassings, etc., air pollution. Your neighbor is spraying their garden with Roundup all the time.
Sure.
So when you stack up this toxic load over time, what happens is it starts to increase inflammatory reactions. And taken as a total, be inflamed all the time because of the toxic lifestyle. So when you intervene, there's some easier detoxification programs now than like water fasting or juice fasting. Those are very powerful and they should only be done under supervision. It's one of the fastest ways to lower toxic load, reduce inflammation, and come out of pain that I've ever seen.
Wow.
But there's also some functional detoxification programs now that integrate some very sophisticated dietary supplements called medical foods or functional foods. For example, there's a drink called Ultra Inflamex, and it's a rice protein-based drink that has very concentrated turmeric and ginger and rosemary that are all known to dial down what are called pro-inflammatory cytokines, or chemicals that are like light switches for inflammation. So when you integrate this kind of a drink, a clean vegetable-based diet, especially initially, and you take out potentially offending foods. So I screen for food allergies. I test for if there's any excess toxicity or infections in the gut, and start removing these things. Maybe go anywhere from 10 days to 28 days on a structured detoxification program where you have personalized medicine-based dietary supplements along with this medical food. And so if you're really a committed patient and you're up for doing this, that's typically the fastest way to start derailing this wildfire that's going on in your body and start reducing the inflammation rapidly, and then start building a lifestyle to sustain that for the long run so you hopefully don't lose your cartilage.
Wow. So, Dr. Nelson, so I did, about a year ago, I did a liver cleanse. I guess it was about a 2-week, maybe a week actually, of, a little bit of fasting for several days and different supplements, eating mostly vegetables, everything else, no sugars for the most part. And it was a little tough going through, but it felt great afterwards. I'm actually thinking about doing it again. But you're saying the type of detoxification you're talking about for patients that would come in with some sort of osteoarthritic flare-up would be roughly about a month, and it would include several, maybe, is it like, you're not fasting obviously for the whole month, but are there like 1 day fast, then you can eat the next day? Like, how does that work?
Yeah, usually, Dan, the first week you're eliminating, I just call it eliminating the crap.
Now, is that the medical term?
Yeah, that's the prescription. On the prescription crap, eliminate the crap, which is, in the book, Arthritis Survival, we talk about the sickening six. So primarily that's unhealthy fats, excess sugars, refined carbohydrates, alcohol, excessive alcohol, too much salt, and we can go beyond that with junk food, etc. And then start a dietary program that's very plant-based, and it's based around a modified Mediterranean diet. The Mediterranean diet has probably the most research of any diet on the planet. And then it integrates these medical food powders like the Ultra Inflamex, and then some very personalized dietary supplements. So the first week is, okay, clean out the cupboards of the offending agents. For example, maybe a common food you might be reacting to is gluten, which is...
Oh my God, sure.
Yeah, which is in wheat, rye, oats, barley, and spelt.
Is that the most common thing that you would say would maybe causing inflammation in people? Because I've heard that before.
Probably the two biggest foods to suspect are the gluten foods and dairy.
Wow.
Cow's milk products, because of the casein, which is a protein in the cow's milk, might initiate the inflammatory process as well. So when you eliminate all those things in the first week, you're still eating. There's a program. You're still eating protein, vegetables, fruit, nuts, seeds, maybe a little bit of beans and a little bit of gluten-free grains. Then the second week, there's a point at which you go down to 3 days of primarily relying on the detoxification medical food and the dietary supplements. You can still do some soup broths, vegetables, and fruit. So it's a modified cleanse. It's not a fast. It's real food load. Then after that 3 days, you start graduating the food back in. And as you do, there's a very specific sequence where you graduate the less complex foods in order to go toward the more complex foods, meaning going from fruit up to really concentrated protein. And then you chart that as to. So this is a learning time where people can identify food sensitivities. And you go, okay, I was feeling great, or maybe I don't feel so great through those 3 days because I'm detoxifying. But then when I'm coming out of that and I'm adding foods, I want to see if pain or inflammation flares up.
Oh, so it's a little, you're actually like doing a little bit of an experiment with your body where you're slowly adding back different things, watching your reaction. I think that's brilliant. Wow, that's great.
Excellent. I've calculated that I've taken over 5,000 people through this, and we haven't lost anybody.
It's always a good thing.
And I used to teach group cleansing programs, and we would survey people at the end. We would have anywhere from 30 to 50 people going through these things. And at the end, the dramatic reduction of pain, it was just stunning as far as how people would score themselves. And it was the most rapid way to do it. And then, of course,
now you're talking that so for someone coming to a podiatrist, we would be treating them, like you say, that this sort of heroic kind of salvage thing. But you're talking about taking people through this without necessarily those heroic measures, and just based on diet, you're seeing a reversal and an increase in comfort, a decrease in discomfort. Is that accurate?
Yeah, that's accurate so long as that they're ages.
Okay.
Not in the late stages of arthritis. I mean, if they do that kind of a program in the late stages, Dan, they might get some more comfort, they might get some pain relief, but of course they might be really progressed. So,
I'm looking at it just from my own selfish reasons for my patients, that people that I'm actually putting through the heroic measures, maybe this would also benefit them to have them listen to this and go on some of that if they like. I mean, I'm sure that, some people, it's obviously a personal choice, but certainly to give them another alternative, I think this would be great.
Yes. And, I do offer, I can offer listeners virtual coaching on this. I do that with people from coast to coast on the phone and through Skype. It really has to be supervised. It has to be personalized. And what I always say from a simple standpoint on arthritis, I always say it's about reducing inflammation, feeding cartilage, and keeping the joints as fit as you can, without over-exercising, injuring the joints.
Okay.
And that's part of the difficult part with, top athletes or what have you, is there's always the overuse issue.
Listen, I just had a patient in yesterday. She had severe plantar fasciitis. We actually cured it. I mean, 100%. I mean, it was without any surgery. We ended up using the amniotic allografts or the stem cells ultimately. And then she went on to start doing very heavy lunges and workouts, and came in yesterday with about a 20 to 25% recurrence of that. And I just think it was almost like an overuse. I mean, she's a little bit heavy, and it just was out of proportion. So what percentage of people, when they start feeling better, start to overdo it a little bit? Do you find that?
Well, in Colorado, as you may know, it's the least obese state in the country.
Right, I've heard that.
It's a super active state. Everybody's hiking, biking, skiing, etc. Yeah. And patients I have to coach to kind of sometimes pull back the reins and say, okay, you need some real gradual exercise going back into it. Let's say if you've had to do a procedure like you were just talking about, and they have to really get some coaching to not re-injure and not to keep repetitively traumatizing the joint, because that just sets it up for further arthritis.
And the other part of it, now that we're talking, it may be that we've never really coach these people or put these people on any kind of change in their dietary situation. So you've actually opened up a whole new area for me to actually work with the patients on. And so I truly appreciate that. Doc, as we're starting to wind down a little bit, I do have a couple of questions. You've written other books on asthma and headaches. And I just wonder, how does this concept of arthritis relate to asthma, headaches, just in a quick summary?
Well, quickly, it all boils back to inflammation. There's some inflammation, and it's affecting you in some way, in some tissue. Show up as asthma in your lungs, where you have too much inflammatory chemicals, but it's a different set of chemicals than arthritis. But it can stem from very similar causes as far as toxicity, and environmental insults.
Would the treatment be a very similar one, at least initially, like the detox, and then slowly put things back into and just see which ones have a negative effect on you?
Yes, anybody with any sort of chronic pain syndrome, I always say the first is a structured functional medicine-based detoxification program, because it may be the fastest way to relieve pain as you begin to reset habits.
Wow, powerful.
Yeah, it's very powerful, because sometimes I'll have somebody come in and their major point of interest is relieving joint pain, yet they also cycle headaches. And they'll go through a 3-week detoxification program like this, and they'll go, oh, by the way, I'm not having my headaches. And we weren't even treating that.
Wow. Dr. Nelson, as we wind down, now you've told me you've actually listened to the show, so as we wind down, the final question is going to looking for that holy grail of health. So I'm going to pose that question to you, sir. What if I were to ask you what you think the holy grail of health is? What would that be?
Dan, I pondered that question before you asked me, and I don't think it's a simple answer. Meaning, wouldn't it be great if we could just take a pill or drink something and magically things would go away? But I think the core of the Holy Grail is practicing exceptional self-care choices on a daily basis in 4 major realms: eating, thinking, moving, and relating. And, it needs to be a holistic view. It needs to be an integrated view where you personally learn with coaching what works for you personally. My diet than yours. My level of exercise may be different than yours. I may need to learn how to think differently with my stress than you do. And then our relationships are powerful impacts on health and outcomes in our life. So those 4 areas, my motto is, how do you practice exceptional self-care every day? Most of us don't wake up going, how do I practice exceptional self-care for myself today? Oh my God, how am I going to get through my day?
Right, or how do I pay the bills for the day? Or absolutely.
So that, to me, is the core of it, is integrating and practicing those habits relentlessly, persistently, fiercely, and with a lot of compassion and humor.
I love it. Dr. Nelson, first of all, thank you for an awesome interview. How do people that want to find out more about you, how would they get in touch with you?
Thanks, Dan. My website is www.tolwellness.com. I do have some free downloadable reports on the website and a few videos to access. And, of course, our books, Arthritis Survival, Headache Survival, Asthma Survival, you can find on Amazon.
Awesome. Dr. Nelson, thank you so much for being with us. It's greatly, greatly appreciated.
Yeah, thank you, Dan. Thanks for all you're doing. Really appreciate it.
My pleasure.
This episode is sponsored by New Jersey Foot and Ankle Center in Oradell, New Jersey. Remember, when you have a foot problem, you've got a foot doctor in the family. Weekend and evening appointments are available. Call us at 201-261-9445. Once again, that's 201-261-9445. Thanks for listening. Check out the show notes over at drdanspeaks.com. If you're loving the show, head over to iTunes and leave us a review, and we'll catch you next time.